And that is why, from all of us at IKD 106.1 FM, we decided that every Thursday we set this beautiful day aside to ensure that we pass the message of health across to the general public, working alongside Ikorodu General Hospital. And a very beautiful way to say welcome to the issues today, being the fifth day in the month of May 2022. Today is another very beautiful day alongside with my people all the way from Ikorodu General Hospital, like I said earlier, while we discuss another very conversant conversation right in front of us. It's not just a conversation, but a day set aside by the World Health Organization to ensure that everyone stays aware. It's an awareness campaign, and that is why we are also doing same here from our studio, IKD 106.1 FM. My name is Adebambo Opayemi, saying welcome, and of course saying good afternoon to everyone out there. Today promises to be not just educative, but at the same time, we're going to be having a healthy conversation. I have with me in the studio great personalities talking about health workers who will do justice to the conversation this afternoon. From my right-hand side, I have no other than Dr. Ajibola Ojikutu, all the way from Ikorodu General Hospital. Good afternoon to you, sir.
Good afternoon.
It's good to have you in the studio.
Same here.
Yes, and from my left-hand side, I have no other than the Deputy Director of Nursing Services, DDNS, no other than Mrs. Aderonke Adeniyi. I say good afternoon to you, ma'am.
Good afternoon.
Thanks for coming. Yes. It's good to have you in the studio.
Thank you.
Yes, you've heard the voice of Dr. Ajibola and, of course, Mrs. Aderonke Adeniyi. And today we have the topic right in front of us, hand hygiene, key to safety. I take that again, hand hygiene, key to safety. Do not forget that World Health Organization has set aside every 5th of May as a day to orientate the general public. And this year we have it that World Health Hygiene Day Awareness Campaign that is set aside. So I would come down to you, Doctor, without wasting too much of our time. When we talk about this hand hygiene, key to safety, the first question I would like to ask is, tell us more about the theme for this year.
Thank you very much.
Yes, please.
So when we talk about hand hygiene,
Yes.
key to safety, we are talking about the importance of hand hygiene. Some people might not understand when you say hand hygiene. It's the same as hand washing. So it
Okay.
basically means washing your hands.
Okay.
And now we are talking about why do you really need to wash your hands. If we talk about standard precautions that we take in the hospital or healthcare environment in trying to reduce infection transmission, hand hygiene is a very vital part of infection prevention and control. And it just doesn't limit us to healthcare facilities alone.
Okay.
Even in our homes, in our offices, infections can be transmitted. And hand hygiene plays a pivotal role in limiting transmission of infection. So talking about hand hygiene and safety, we are trying to increase the awareness that by performing good hand washing, you can actually limit transmission of infection from one person to another.
Thank you very much. I think that's a very beautiful one, I must tell you, Doctor. I'll come down to you. When we talk about hand washing, just like you have put it rightly, just like you rightly said, hand washing to some persons, the believer, this came up during the time of COVID-19. That is when some persons started seeing the essence of even washing their hand. So I would ask you, Ma, what is the essence, the real essence of this hand hygiene?
Okay, thank you very much.
Yes, please.
Like Dr. Ojikutu said, hand hygiene basically means taking care of your hands. And it's in two ways.
Okay.
Either you wash with soap and water or use your alcohol-based hand sanitizer.
Okay.
Yes. Then why we do this is to break, we have what we call infection chain. Once you wash your hand, and I wash my hand,
Yes.
that chain is broken. I can't pass whatever I have to another person. That's why it is very, very important that we should all unite in safety. We should all decide today to wash our hands continuously.
Doctor, you would agree with me that it's very important. It's key to ensure that we wash our hands regularly. This would actually limit the spread of diseases and viruses all over. So I would ask you, what are the major hygiene practices? Not just, if you say hand washing, we know that, okay, I just put my hands in. But as a medical practitioner, sir, what are the major essence, the major hygiene practices?
All right, thank you very much. So, still talking about hand hygiene.
Yes.
WHO, that's World Health Organization, has broken it down for us, especially for those in healthcare facilities.
Yeah.
There's something we call the 5 moments of hygiene.
Okay.
Those are moments where we need to wash our hands.
Mm.
Now, people might say, "Oh, I wash my hands in the morning before I leave my house. I take my bath.
Yeah.
That is enough." But looking at it, you go out, you take public transport, you hold doorknobs, you receive handshakes from friends, you go to the office, you touch your tables. All those points are points where you actually need to perform hand hygiene because you don't know what has been deposited on that table. Microorganisms are everywhere, even on the clothes we wear, in the air we breathe in. So hand hygiene helps us to reduce or limit the spread of these microorganisms from one person to another. Once I ensure that I wash my hands adequately, I'm not likely to transmit any microorganism to someone. Now, if we look at it, there are people that are even that are more susceptible to infections in our environment, like small children, so little children, elderly people. Some people have reduced immunity for one reason or the other. Now, if we are saying we are doing this hand hygiene for ourselves, it's not just for us. It's for these people that might not be able to protect themselves from these infections. They have reduced immunity for one reason or the other. So protecting yourself by hand washing also means that you're protecting your neighbor and ensuring that we have a safe community, a safe environment for everyone.
Does this hand hygiene have to do with environment? Because sometimes some persons will just feel like, I stay in a clean environment, my house is always very clean. Do I really still need this hand hygiene? Does it really have to do with the environment?
Okay, so it has a close relationship with the environment in the sense that every environment has microorganisms. Whether you live in a mansion or you live in a face me, I face you. So wherever you find yourself, you are meant to perform adequate hand hygiene. So it's not just about the environment you are, whether it's clean.
Irrespective of if it's clean or not.
Exactly, because you actually can't see microorganisms with your naked eyes. So they are everywhere. That is a sure fact.
All right, so Mrs. Aderonke, I'll come to you on this one. When we talk about hand hygiene, still talking about hand washing, what are required? What is actually really required of a proper hand hygiene?
Okay, thank you very much. Like I said, it's in two ways. For hand hygiene,
yes,
if you decide to choose to wash your hand under running tap, you need your liquid soap.
Okay.
Yes, some people decide to use a bar soap, but it is more acceptable to use a liquid soap. You need a running tap, which we are privileged to have it in from the gate of Ojikutu Hospital.
Wow.
So every nook and corners, every department, before you access it, you have it there at the point.
Well functioning.
Functioning.
Wow.
Then you also need your disposable hand towel, not handkerchief, not drying your hand anyhow. Then you need to make up your mind yourself that I want to comply.
Okay. There's a place of personal decision.
Yes, about hand hygiene. Because there are things that you need to do before, like as a nurse.
Yes.
Before I go to a patient, I have to do my hand hygiene. After attending to one patient, I still have to do it again before going to the next patient. So yes, we look at it as if it's cumbersome, but that's the rules. Then for your hand rub too, the hand rub, yes, it's portable. You can put it in your bag. That one, if you cannot access running water,
okay.
If you cannot access it, and if you know that you have exposed yourself one way or the other, maybe to handshake, maybe you visit the law or things like that, or maybe you visit the hospital environment. Yes, hospital environment, you can just see, yes, this is hospital environment. I can't see any microorganism with my eyes.
Exactly.
But they're there. You have touched the seats, you touched the railings. You need to either you use your hand rub or you wash your hand. Then for the hand rub, after 10 use of the hand rub, you need to wash your hand. Compulsorily. You need to wash your hand. So for the soap and water, yes, it's available, and like we see now all over the place. You go to public places, you find the thing out there.
Yes.
And water is running. And even in schools too. In the market, open spaces is all there. In all those event centers, they are all there. But what we need most now is to unite for safety, compliance.
All right. Thank you so very much, Mrs. Aderonke. I'll still come back to you on the effect of not complying to this, because there's a part where you mentioned the place of personal conviction, a personal decision. It's a thing that we all have to unite together to do. But then, like I said earlier, this pandemic period at the time brought the consciousness of people to washing your hands and all of that. So many persons are not even ready or willing to do that. So we look at the effect of not complying to this proper hand hygiene system. But before then, I'll come down to you, Doctor. The World Health Organization sets this day aside every year, 5th of May. And one of the emphasis laid on was the safety climate. Talk about the culture. What does this mean? And what exactly is World Health Organization saying about this?
All right. So the World Health Organization is trying to promote hand hygiene. And that's why we set aside the 5th of May every year to celebrate World Hand Hygiene Day. Now, when we talk about safety climate, it's just describing an environment where whatever services we are rendering is safe. Now, safety is safety in what it means.
Yes.
Now, it means that we are rendering safe healthcare or safe services to our clients. So, a safety climate is a climate where people can access care or access services without fear of picking up something dangerous from there. So, it means that there's no risk in that environment. A safety climate is a safe environment where people can access services without fear of risk or infection. So this cannot come in place if we all don't unite to perform adequate hand hygiene. The doctor, the nurse are not the only ones in an healthcare system. You have the patients, you have relatives of patients, you have those that just come to see what is going on. So if we all decide to perform adequate hand hygiene and keep it as something we do all the time, there's a very high chance that we would all together create a safety climate. And this culture we are talking about just means a lifestyle.
Yeah.
So we make hand hygiene
part
a
and parcel
lifestyle
of
becomes
you.
a part of us. It's something we do without anybody prompting us. We know when to do these things and we do them effectively. This helps to create a safety climate for adequate and safe quality healthcare delivery.
Thank you very much, Doctor. If you're just joining us, this is The Issues on IKD 106.1 FM. And today I have medical practitioners from Ikorodu General Hospital, like always on Thursdays. And today we talk about hand hygiene, key to safety, while I have Dr. Ajibola Ojikutu, and of course, Mrs. Aderonke Adeniyi, who happens to be the Deputy Director of Nursing Services, Ikorodu General Hospital. So, I come back to you, Ma. When we talk about hand hygiene, what are the effects?
Thank you. Talking about the bounce back effect, it goes a long way from the healthcare practitioner herself, from the caregiver. As a caregiver, I'm supposed to do no harm to my patients. And I now refuse to comply. Imagine what I would do to cause my patient. My patient comes in with malaria and is going home with something else. Is going home with something patient acquired from this within the hospital, which can be prevented. Then my patient too, refusing to comply too. The patient now, maybe the patient is discharged or comes as an outpatient, goes back home to his own family, the community. The spread just goes like that, which we can just do one simple thing: wash your hands. Hand hygiene.
Thank you so very much. Do not forget that you can join us on our social media handles on Facebook and of course on Instagram. We are there at IKD 1061 FM. And of course, you can listen to us live and direct from anywhere all over the world via our website www.ikd1061fm.ng. I still have with me medical practitioners from Ikorodu General Hospital doing justice to a day set aside by the World Health Organization, World Hand Hygiene Day Awareness Campaign. So we talk about this campaign. Dr. Ajibola, what is the policy makers now? Let's talk about this policy makers, because this is an awareness already that you guys are doing, which is fantastic. How about the policy makers? How are you guys working hand in hand? Is there any platform whatsoever, or it's just you and you thing alone?
All right. Thank you very much. Now, World Hand Hygiene Day is something celebrated all over the world. Every country has a part to play when it comes to World Hand Hygiene Day. Now, when we talk about the policy makers, so looking at policy makers, we're looking from people in government,
exactly,
head of facilities, hospital administrators, even clerics, imams,
exactly,
community leaders. They are all policy makers.
True.
And as a family person in your family, the head of the family is also a policy maker.
Very correct.
Now, so we are reaching out to everyone and everybody. That is a joint effort. It's something that we all need to unite to do. We need to make it a priority to perform hand hygiene. and ensure that we limit spread of infections in our communities. Now, it's not just about infection in the hospital now. We are just looking at community level, home levels. Parents come to the hospitals, go back home to their kids. Kids have very low immunity.
True.
And every little microorganism can cause them serious problems. So if the parents had performed good hand hygiene before getting to the house, they are not likely to transmit anything to the children. And that's also going to help us as a country. It means we have less people coming to the hospital with sicknesses. We have less people missing work. That's going to help our economy to grow because it means that we have less absenteeism from work.
True.
So all these things are things we all need to unite to do. I'm sure that our government is doing a lot. Even at the level of the hospital Ikorodu, the MD CEO has done a big job in the hospital. We have a lot of hand washing points, starting from the gate.
Wow.
Every department has hand washing units. And this is something that the IPC team in Ikorodu has been monitoring and evaluating. So we do that regularly. Even today, we've had awareness campaigns within the hospital where we spoke with patients and clients in the hospital about the World Hand Hygiene Day. And we've even had some of them demonstrating these things just to ensure that we all pass down this knowledge and we take it back to our communities.
All right, thank you very much. I was about asking you, talking about policymakers, I was about coming to the point of health workers as well, too, that what are the things being done by the health workers? That will bring me to you, Mrs. Aderonke. Health workers, just like you have said, Ikorodu General Hospital has made facilities, resources are available. But then we talk about our society, our community, the nation at large. What are the activities being carried out by health workers to ensure that the society is aware? Because if you say that General Hospital Ikorodu, for instance, has made provisions and resources, how about those that are not in the hospital? How about those that are not coming down to the hospital? How do they get the information? For instance, you're here now to carry this information outside. How about other measures by health workers?
Okay, thank you very much. Hand hygiene is a component of the IPC.
Okay.
IPC means infection prevention and control.
Okay.
Hand hygiene is just one of the components.
Oh.
And in the last few months, we trained over 700 health workers on IPC.
Over 700?
Yes. With the support of our CEO, our MD, Dr. Tawa Zan.
When you say over 700, in Nigeria or Lagos?
In Ojikutu General Hospital.
Just Ikorodu here?
From the gate man to the ambulance driver, to the cleaners, to the nurses, to the doctors.
Wow.
And we do it periodically.
Great.
Whenever they have any new staff, like it has been done, I think in few weeks ago, they had training for them too. So when all these staff are trained, we train them to train others. They go back to their community. They go back to their churches. They go back to their own local environment with their CDAs. Call them, we work in the hospital. Tell us about this. They're able to dish something out. So we really want to appreciate our MD. And for information again, he said we should start another training next week for clinicians.
Wow.
And that training for another set of people again, which we are already on it again. That's it.
All right, thank you so very much. This is very beautiful, I must say, and I must say well done to Ikorodu General Hospital, and of course the MD as well. He's my very good friend. Please send my regards to him. Yes, so I come to you, Doctor. Is it true to say that the hand is one of the major reasons for a lot of infections being passed around? Is that true, or is that a fallacy to say?
So that's very true.
Okay.
In fact, there are statistics that say that proper hand hygiene helps to prevent at least 80% of infections.
Wow.
Generally. So there are a lot of infections that can be transmitted by the hands. We can talk about salmonella, typhoid. We talk about even respiratory viruses like the common cold, the influenza. People take handshakes, and before you know it, they start having the flu. So if you can actually break that chain of transmission by performing good hand hygiene, there are so many infections that we can actually limit or even reduce entirely. Wow. So yes, the hands play a major role in infection transmission.
0904-081-1061 is the studio line. 0904-081-1061. You have the opportunity to speak directly with either Dr. Ajibola or Mrs. Aderonke. If there will be any questions whatsoever, you can call us on 0904-081-1061. Just like every Thursday is set aside for healthy conversations here in our studio, IKD 106.1 FM. Of course, do not forget, like I told you, you can listen to us from all over the world via our website, www.ikd1061fm.ng. And of course, also on Radio Garden, we are very much available. Mrs. Aderonke, how expensive is it to practice this so-called hand hygiene? To some, it's expensive. How expensive is it?
It depends on how you value your health. Health is wealth. Nothing is too expensive to sustain your healthy and well-being. How much is liquid soap? Like in this general school now, we are self-sufficient. We produce our own liquid soap.
Wow.
We produce our own sanitizer. The pharmacy department, they do that.
Wow, that's great.
Yes, and
Wow.
and I'm sure of so many other hospitals in Lagos State too. So we can look decide to make things cheaper for ourselves. There are ways of producing soap that anybody can learn. It's not as if the soap making is so expensive. So every home should buy the culture. Soap is not expensive, and water is there free of charge.
Very free, I must
Very
tell you.
free.
Very free.
So what are we talking about? The major thing is self-will, and that's what we are advocating today. Let us all unite for that safety. You teach our young ones, you want biscuits, go and wash your hand. If you do that, go and wash your hand. Daddy drives home from work, he stays in the car, uses hand sanitizer before hugging his children. And they would not see these young ones, if you teach them young, they get it right.
True.
They get it right.
True. Thank you so very much. We will be wrapping up on the show, but I would ask you, Dr. Ajibola, just like those who will take care of your teeth will tell you, brush at least twice in a day. When you talk about hand hygiene, is there any specific number of time to wash your hands daily, or there are no specifics?
All right. So, sincerely, I would say there are no specifics. You should wash your hand as many times as you can. Now, the reason why I said this is there are so many things we do daily that, if we think about it, actually requires us washing our hands. Just like coming to the studio, I might have given you an handshake. So I should have done my hand hygiene after that. I go out to a party, somebody gives me a bottle of drink. That process alone requires me to wash my hands.
True.
Mothers change diapers for their kids. Mother wants to cook. She just finished cooking. Somebody went to the loo. You're coughing, you're sneezing. All those processes require hand hygiene. So it means that even just thinking about it, you should actually wash your hands. So it should become something you do regularly.
Okay, so talking about motivation right now, before I come back to you, the essence of our meeting here right now is create awareness campaign. But there should be a motivation to this, Doctor. It's really not easy. I noticed you didn't shake me when you got into the studio. Maybe that is the reason. Maybe that is the reason why you have refused to shake me. It's fine, but I will shake you by force immediately after this show. So for motivation now, it's really not going to be easy for me to just start washing my hand like almost all of the time. A lot of persons are listening to you right now. The whole of Nigeria is listening to you. What is the motivating factor that will keep people going on this so-called hand hygiene and safety?
All right. So I can say this. By performing adequate hand hygiene,
Yes.
you're actually going to be saving a lot of money. Now, that's a big motivation to everybody, especially in Nigeria. Saving money, not spending money unnecessarily. People spend money on antibiotics every week, some every 2 weeks. Those things can be avoided by good hand hygiene.
Wow.
So we are saying that by performing adequate hand hygiene, you can actually reduce cost of hospital bills and hospital visitation generally. And when you have good health, you are likely to make more wealth. So it's important to know that your good health is tied to your hand hygiene. So the more hand hygiene you can perform, the richer you can actually be.
Yes.
When we look at it in the large picture.
So I come to you, Mrs. Aderonke. I'm already enjoying the conversation. It's as if you guys should not leave. The essence of World Health Organization this year, 2022, the theme for this year is World Hand Hygiene Day Awareness Campaign. I know there is so much to say about that. The microphone is open. The awareness, people are listening.
Okay. Every 5th of May has been a mark for World Hygiene Day celebration by WHO. And we at General Hospital Kudu, we are keen into it. And the theme for this year's awareness is Unite for Safety,
Yes.
Clean Hands. And what does it mean? It's telling everybody, young, old, even the one that is going to be born today, that we should unite for safety by cleaning our hands. If only clean our hands can make us safe, it goes a long way. Okay, now COVID came, everybody was scared. They were even scared of us in our neighborhood.
True.
They work in the hospital, but they still see us standing. They are wondering what's so special about these people, because we chose to do the right thing at the right time with the right products. That's it. So that's what we are advocating today too. Everybody should choose today to do the right thing. And what's the right thing? Choose to unite for safety. Choose to have your hands clean. The choice for safety with the right product, not just any soap, with the right product, doing it in the right way. When we talk of hand washing, not just putting water and rinsing your hand. That was most people miss out. It has steps. It has steps to the fact that it will take care of both in between the fingers, take care of your under your nails, take care of those lines that you cannot even see that are things there.
Yeah.
So this is what we have started today again by creating awareness with our patients. We went to different outpatients and we gave them the opportunity to practice with us. And you will see it when we start uploading everything online.
Yeah.
So, and that's what we have done today. And what we are asking for is that support from everybody. And though the policymakers, the leadership, thank God for Okodu General Hospital, we want other leadership to prioritize IPC, infection prevention and control. That we are advocating today, to prioritize it, to make it their priority. Yes, priority means to give to meet to dish out resources, because yes, IPC, infection prevention and control, you need certain things to for Dr. Azam to have done a lot in Ikorodu within that short while. We give kudos to him to make water run 24/7 in a facility as big as that, to put liquid soap on every zinc in a facility as big as that, to give us opportunity to train over 700 staff in a facility as big as that. So we are enjoying everybody listening to us now. In our houses, let us imbibe clean hands. From our children to the adults. Even I look at one old man at the outpatient. When I extended the hand sanitizer, the man opened his hand.
Wow.
And he was following the step Dr. Ojikutu was teaching them.
Great.
Yes, and I'm sure all those who came to dinner would take it back. We saw something different he could do. They taught us how to wash our hand. It's not just pouring water on our hand. So that's the safety we want. If that safety is there, nobody will visit the hospital. They will only go to the hospital to go and say, congratulations for you have a new baby. That's what we'll have.
Yeah.
Yes. And everybody will keep their money in their pockets. So with the WHO, with the Ikorodu Hospital, we're all joining hands to say, let us unite for safety. Clean your hands.
Thank you so very much, Deputy Director of Nursing Services, Ikorodu General Hospital, Mrs. Aderonke Adeniyi. It was so nice having you here in the studio. I enjoyed myself, I must tell you. So, Dr. Ajibola, your parting words to all of our listeners.
All right, so I'm going to say this to everyone, that today is World Hand Hygiene Day.
Yes.
Ikorodu General Hospital is saying hand hygiene is a key to safety. And all over the world, say that unite for safety, clean your hands. Thank you very much.
Yeah, thank you so very much, Dr. Ajibola. This is how much we can take today on the issues. And of course, a very big thank you to Ikorodu General Hospital for doing justice again this very beautiful Thursday, 5th of May 2022. My name still remains the same, Adebambo or Payemi, urging you to have a beautiful day ahead of you. Tomorrow, we have another beautiful conversation on the issues. But for now, it's a bye. Good afternoon.